Welcome to Beyond the Charts, a podcast series featuring Cira Monnig, founder of Lakeside Care Clinic. Each episode shares real stories and a fresh perspective on health and wellness, all rooted in compassionate, personalized care. At Lakeside Care Clinic, it's never just about the numbers, it's about going beyond the charts. Hello, everyone. Welcome to another edition of Beyond the Charts. We're talking a lot of fun stuff today. I'm here with Cira Monnig, and we are talking about hormone replacement therapy.
We are.
And, it's kind of like something that's been around for a while, but then it kind of went away and now it came back. Tell me kind of the brief history of hormone replacement therapy and what it started out a while. You were telling me before we got on the air that it started out that you used to do a lot of it and then people got away from it and now they're coming back to it, right?
They did. I mean, when I think about physicians a few decades ago, it's interesting because a lot of people were getting put on hormone replacement. However, then there were a lot of studies that came out with the synthetic hormones saying that there were increased risk for breast cancer, increased risk for stroke, heart attacks, all the things. And so it kind of became taboo where a lot of physicians no longer want to prescribe hormone replacement at all. They'll look at the hormone panel and they'll say, oh, you're what you expect for your age. And that's where it's like, okay, well.
So isn't that the whole thing behind hormone replacement? You don't want to feel your age.
Right.
You want to feel better.
That's exactly it. Our goal is to slow the aging process, right? Age with grace and all the good things. So when you kind of look at risk and benefits, it's interesting because the synthetic hormones do carry a little more risk. However, when you look at bioidentical hormones, that's the difference. They don't have the risk that the synthetics do. So they actually have health benefits. So there's a lot of studies out that show with bioidentical hormone replacement, they actually improve your or reduce the risk for cancers, reduce the risk for osteoporosis, reduce the risk for chronic disease process, reduce the risk for dementia. It's very interesting when you start diving into the studies for the bioidentical hormone replacement and understanding how it literally can make you healthier as you age.
And so is the process that you do a panel, you take the hormone panel and you kind of just see where the deficits are, maybe what someone, and you kind of know too, I guess age and gender and all that has something to do with it. You kind of already can anticipate.
Correct.
The human body over time is going to need some help if you provide it to it. Who is hormone replacement therapy for though? Is it just men, just women? Everybody can do it?
No, it's it's men and women. And it's interesting too, because as previous, or when we think about hormone replacement, we think it's just for older people, right? Women that are going through menopause, men who maybe have a decreased sex drive, but we're seeing it in the younger populations, even late 30s, early 40s. Really? We are. I think that has a lot to do with just our food. Our food in this country is crap. I think we all know that. There's a lot of additives. There's a lot of chemicals. There's a lot of
hormones in the foods, right?
There's a lot of hormones in the foods. I mean, we're pumping estrogen into the beef that we're eating and the chickens and all all of that. Well, if you think about it, we're eating that food. So that in itself is going to cause dysregulation to our natural hormone balance. That's why we also see such a dysregulation in insulin and seeing insulin resistance, which that can take us on a whole nother pathway.
We have a whole other podcast for that.
Yeah, a whole other podcast. So, but as far as the hormones go, that's why I think that's a lot of why we're seeing it in the younger population and not just the older population. But nonetheless, the symptoms are there, right? The fatigue, the mental fog, the reduced sex drive. And a lot of people will chalk it up and say, oh, I'm just getting older. I'm not interested anymore. And that's just inaccurate,
And nobody wants to be, look, I'm at 57 now, certainly in the second half of everything. And you do start to, all of a sudden, it doesn't hit you gradually. All of a sudden you wake up one day and you're like, how'd I get here? This is,
right.
I need to get some help on some things.
Exactly.
And so, but the cool thing about it is that they can come to you and they can do their hormone panel and you can kind of help figure out what might, and there might be other things besides hormones that you find out too, that are you're working together with a lot of different processes.
A lot of our workup is not just looking at hormones, but it's ruling out other problems, right? We don't want to just throw any extra medicines on anybody without ruling out other cause, finding the root cause of the problem. So we're not just looking at, okay, what's your hormone level, but we're ruling out any kind of thyroid issue, undiagnosed diabetes. We're looking at your just basic blood count, your kidney function, your liver function. So we're going to rule out a lot of other problems that could contribute to hormone dysregulation, pituitary problems. So that's a big one as well. So we're going to rule all of that out before we even discuss, okay, this is maybe what you need.
And full disclosure, I'm a member, so I'm taking advantage of your program. And I know I came in about a month ago and the first thing you said is, let's do a panel, let's do some blood work. And it was just amazing, the detail that you got back to me with all the different things you're checking on, all the different areas that you look at. And you can tell a lot by that, right? And I'm sure the hormone panel is the same way. Like it's going to tell you what's going on.
You can tell a lot. You can. And also interpreting the hormones. So, and this is where I think it differs between when you're looking at more integrative type medicine, which I practice, or traditional type medicine, which is more, again, going to your traditional primary care provider. Because they can look at a hormone panel and they're going to say, oh, it's all normal. I'm going to look at a hormone panel and say, but this could be better.
Right.
We're going to optimize these levels because you're symptomatic, and every single human being on this planet is different on a cellular level. And we have to treat it that way.
And that's kind of cool too, because, you can be like right on the edge of being normal, but if you're on the low edge and you're right there, and you don't want to stay there, like you want to get better, you want to feel better. And you guys really take the time. I mean, that's the part that I love about Lakeside Care Clinic, is that when you go in there, there's not a clock on you. You're not sitting there and you're not running in for 5 minutes and saying, here's what's going on, and then getting out. I mean, you're really spending some time figuring out what's going on. How do you want to feel better? What can we do? I've got several different ways to get you there. Sometimes they all work together. Sometimes we'll piecemeal it, but it's a really refreshing atmosphere to be in.
That's truly my goal, is that people come in and we can get to the root cause of the problems. I think that in traditional medicine, it's very hard for the providers to be able to do that, just from the pressures. We've talked about this before, pressures going up from administration to even government policies, which then puts the pressure. It's a downward slope to the providers and their time. My goal is, and which is why I'm cash pay, I take that problem out, right? And so I can spend the time with the patients, and I can mark off an hour. Honestly, I had 2 people come in the other day. I marked off 2 hours because
For 2 people?
Yeah. Because they had a lot of stuff going on, and I knew, like, we had kind of talked briefly before their consultation appointment, and I knew there was a lot of things that we needed to address and discuss, and I just don't want to be rushed for time. Like, we want to get to the bottom of it.
I mean, in a traditional setting, a doctor is expected to see probably 10 to 15 people an hour.
Well, in a day, they're typically an hour. They're going to see about 6 probably, but in a day, they're expected to see anywhere from 25 to 30 people in a primary care setting. That is just not physically possible.
No, and it's not great for the patient or you.
Not great for the patient. It's not great for the provider, because then they're going back and charting on their downtime. It's just not, no one's winning in that situation.
Let's talk a little bit about, why it matters, why the hormone replacement matters. So, there's stress, there's toxins, there's an imbalance. You talk about brain fog and fatigue. I thought that just came with aging. I thought just, low libido, all that stuff that goes into it. But you're telling me that doesn't have to be that way.
It does not have to be that way. That is you just said it. I thought it came with aging. And that's what people think. And that is not the case. There are so many things. Well, let me back up and say stress, toxins in our environment, toxins in our foods that we're eating. It doesn't matter if you're trying to eat healthy. Our healthiest foods still have additives, toxins, all of the stuff that we do not need in our body that causes endocrine dysregulation or on a metabolic level. And when that happens, it causes essentially chaos in our body, inflammation, brain fog, joint pain. And that can present in so many different ways for so many different people.
Right.
So when someone comes to me and talks to me about this situation of telling me their symptoms, I think about hormones. I think about vitamin deficiencies. You know, glutathione is, I think I've talked about it before. I love it. It's so amazing. It's the antioxidant, but I'm not looking at one thing. I'm looking at so many different things. Of course, we're ruling out any major medical problems as well, but so much of what we're seeing anymore in the medical world is these vague symptoms, and they get put on antidepressants and they give muscle relaxers. And it's like all these Band-Aids that are being given out. But really, we need to start looking at the cellular level of what are we missing here? What is not being balanced correctly?
Well, and, you know, I think when you talk about Lakeside Care Clinic and what you guys do, you tell me how it works. So I come in, I do a panel. Then what is the process? I don't even know. Is it a shot? Is it a drink? Is it a pill? What is it?
So people have different preferences. And I kind of listen to what each person, you know, what their individualize the treatment plan essentially. But you'll come in, we're going to talk about all the symptoms that you're experiencing. Then we're going to do a blood panel. It takes about a week to get back. And then once we get that back, I'm going to call you and we're going to go over the lab panel and go over all the details of it. And then we're going to talk about treatment measures. If we're prescribing hormone replacement, then you have the option of creams, topical creams. You have the option of pills. A lot of people like the injections for testosterone, which I do. That is the synthetic version. So I always talk to people and say, well, it is, yes, it's an injection, but it's also not getting the health benefits that the topical cream for testosterone gives you. It's absorbed differently, and therefore you don't get for example, the topical cream for testosterone. It actually is processed through the liver and causes a reduction in your LDL, which is your bad cholesterol. So you'll actually see an improvement on your cholesterol panel by taking the bioidentical form of testosterone versus the synthetic form.
Really?
Yeah, it's very interesting. But some people are like, nope, I don't want creams. I just want the once a week injection. And so, and that's fine too, you know. I think that it's better to have something that they're going to take than have something that maybe it's better in this round, but they're not going to use it. So they're still not going to get the overall benefits of it.
Yeah.
So we'll do both injectables, topicals.
And then are you on a regime then for like once a week for a while, or how does it?
Yeah, the injections are once a week. The topicals are daily. The pills are daily. And then we recheck it in 3 months.
So 3 months, every 3 months you check?
Every 3 months, yeah. Typically, I'll send a medication to the pharmacy. They'll have refills. They can get it. And then in 3 months, we recheck lab work and discuss, okay, where are your levels now? Where are your symptoms? That's more importantly, or more important than even checking the labs a lot of times, right?
How do you feel?
We know you need them. Tell me how you feel. And then we're going to decide.
But once you start replacing, does the body take over? And then, you know, is it a kind of a thing where like, you just don't have these in your body, so we got to constantly replace them.
You do. And
so it's not like your body's not going to all of a sudden turn on and start making that hormone.
Right. If it wasn't making it to begin with, then it's not going to make it in the long run. Yeah. Right. So that's, when you're replacing them for a lifetime. Yeah. That's why a 20-year-old male comes to me and wants testosterone. Probably not going to give it to him. You know, I'm like, you've got a lot of life to live. Right. But there's still, even in that situation, because I have seen 20-year-olds with low testosterone levels, there's other things that we can do with supplements that are precursors to testosterone and actually trigger your body to make its own testosterone at a higher level.
And so we talked a lot about men coming in. Women, I'm sure, do the same thing, right? You got a lot of stuff going on for women that they can help. I know that as women age, just like men, there's just a lot of stuff going on, and you want to feel better. You know, the energy level is, I think, maybe the biggest thing. Like you talk about brain fog and fatigue, and you know, you want that spark again. Yes. So
and skin. It actually, people don't think about it, but the loss of your hormones as we age actually causes increased aging with your skin. Okay. It causes increased dehydration to the skin, increased laxicity to the skin. So, as we age, our faces tend to droop a little more. And that also is due to lack of hormones. And so I always like to get with women like early on when they're experiencing the symptoms so that they can really take full advantage of slowing that aging process down.
So it's just as simple as just going, making an appointment at Lakeside Care Clinic.
It is.
Coming in, you have a lot of options. So you can become a member.
Yes.
We talked about that. I became a member. So you pay a monthly fee. That comes with a lot of things that, you don't have to worry about how many times you're going in and if you have a problem. But you have walk-ins too, and you have people that just come in for a particular treatment, right? So they don't have to be
a member.
But member is definitely a way to get advantages, I think.
Members are a huge perk because with hormone evaluations, there's consultation fee. And so the consultation fee is $250. And then you pay for your meds and your labs, but you get your labs at a discounted rate because you get them at my price.
I just did
dirt cheap.
I just did a whole blood work. I mean, a big workup with you. Yeah. And I was like, okay, how many hundreds of dollars is this going to be? And you're like, it was $50. And I'm going, how in the heck could it be $50? But you're like, well, you're a member, and we passed some of that on. And I mean, it was awesome. I mean, it truly is what I think is the next level of healthcare, because I can get in when I want. Mm-hmm. I can tackle things that I've been wanting to tackle for a while. And being a member, I don't have to worry about being nickel and dimed every time I come in. And
so to that point, I waive the consultation fee and the follow-up fee. So if you're a member, I'm not going to charge you an extra $250. Like, you're paying that membership fee, and hormone replacement is, to me, hormone replacement is part of primary care. And if I'm your primary care provider, then that's something that I should be offering to you as
treatment. You're basically then giving them almost half of their membership fee, but just in that one thing. Exactly. So, I mean, guys, look, this is an amazing place. They're doing so many things. We have already talked a little bit about just the general walk-in. We've talked about just general healthcare. Now we're getting into some deeper topics, hormone replacement. We're going to get into weight loss. We're going to get into hydration and all those kind of things. But you have to go to Lakeside Care Clinic, and you have to see what they're doing over there. And you're growing. Like, you're adding people. You were just telling me you're rapidly adding people and services, and you're just, it's really expanding. And I think it's catching on. Like, this is cool.
It is growing rapidly, and I'm very grateful, and I'm very excited because I think people are, they're ready for a change in the medical world. They're ready. There's a level of distrust in the community for the medical world. And my goal is to teach people that you can still have healthcare and trust your provider, but you need to be a vital part of that decision making. Mm-hmm. And I think that's what's changed over the years. And so I'm just excited. I love it when I can meet people and truly involve them in their own care. The medical world loves to say, oh, we're going to individualize care, but they don't really mean it.
Right. It's something fun to say. When it comes down to it, they have to hit a quota.
Right. And so whereas by me not having to take insurance, I don't have to stick to those same guidelines and those quotas and things like that. So I can spend the time with my patients. I can truly treat them individualized. Like, you tell me where you are, and that's where I'm going to meet you.
And there's no, we're at the lake, and let's face it, there's a lot of people down here that don't have a healthcare program. Yeah. They don't. And if you don't have a healthcare program, you must get over to Lakeside and get signed up, because it's providing them, while it may not be the end all of healthcare, it's going to provide 85, 90% of what someone's using daily, or even stuff like this is so specialized where you're like, this is incredible. I want to be involved with somebody that actually cares about me, that spends time with me. Like you said, not 5 minutes in and out and what's going on. I've got a little bit bigger story than that. I want to tell it. So this is great, because this episode on hormone replacement therapy is what we're going to be doing as we get into more of these podcasts. We're going to dive deep into what this stuff is and how it works, so that you guys can make an educated decision, so you can get in and kind of see, hey, I don't have to be sitting around stressed, brain fog, fatigued. There's help, and I can go get it.
There is. And we are here to do it. So I'm excited about it. Yes.
Well, thanks for joining us today. We're going to be back with another episode in a couple weeks. But right now, you got to get over to Lakeside Care Clinic. Make sure that you go see them and check out all the things they have to offer. You might just go in because you need, someone that's watching your general health care, but you also may need some hormone replacement. You might do some weight loss stuff, which I might be getting involved with. So we'll leave that for later. But thanks for joining us today. It was so great to have you again.
You can.
All right. See y'all.
Bye.